According to the American Lung Association, tobacco use, along with exposure to secondhand smoke, are responsible for more than 480,000 deaths each year in the United States. Even though most people today are aware of the many health risks that come from smoking cigarettes, tobacco use continues to be the leading cause of preventable death and disease in the country. To quit smoking, you not only have to change your behavior, but also cope with the withdrawal symptoms that come from cutting out nicotine. But there's good news. The right game plan can help you break free from nicotine addiction and kick the habit for good. Here are 5 tips to help you quit smoking. Number 1, prepare for your quit day. Once you decide to stop smoking, you should set a quit date. Pick a day that's not too far into the future, but one that gives you enough time to prepare yourself. You can choose to quit abruptly, where you smoke right up until your quit day and then stop, or you can quit gradually, where you reduce your smoking slowly until you reach your quit day. Research shows that both methods are equally effective. Keep in mind that daily activities can often trigger your urge to smoke. Activities such as waking up in the morning, eating a meal, or even taking a coffee break. It's important to break the association between the trigger and smoking so as to fight the urge to smoke. Here are 4 things you can do to fight the urge to smoke. Delay until your cravings pass. The urge to smoke usually comes and goes within 3 to 5 minutes. Practice deep breathing. Breathe slowly through your nose for a count of 3, and then exhale through your mouth for a count of 3. Drink water sip by sip, and do something else to distract yourself from thinking about smoking, like going for a walk. Number 2, use NRT, nicotine replacement therapy. Quitting cold turkey is a popular way people attempt to quit smoking. However, only around 6% of these cold turkey quit attempts are successful. We tend to underestimate just how strong nicotine addiction can be. NRT can reduce the cravings and withdrawal symptoms you experience that can hinder your attempts to quit smoking. They are designed to wean your body off of cigarettes and supply you with a controlled dose of nicotine while sparing you from exposure to some of the other harmful chemicals found in tobacco. The FDA has approved 5 types of NRT: skin patches, chewing gum, lozenges, nasal spray, and inhalers. If you choose to go this route, talk with your doctor about the best way for you to start nicotine replacement therapy. Contact your doctor if you experience any side effects while taking these. Number 3, consider non-nicotine medications. The FDA approved 2 non-nicotine containing drugs to help smokers quit. These are bupropion and varenicline. Bupropion works to reduce nicotine cravings and the symptoms of nicotine withdrawal. It's taken by mouth in tablet form for 12 weeks, but you can use it for an additional 3 to 6 months to reduce your risk of smoking relapse. Varenicline works to reduce the pleasure you get from tobacco use and also reduce the symptoms of nicotine withdrawal. It's taken by mouth for 12 weeks, but you can take it for a further 12 weeks to reduce your risk of smoking relapse. There are possible adverse effects with using these drugs, so talk to your doctor if you experience behavioral changes, depression, aggression, suicidal thoughts, or actions. Number 4, seek behavioral support. To effectively quit smoking, you need to address your emotional and physical dependence on nicotine. There are counseling services, self-help materials, and support services that can help you get through this time. As your physical symptoms get better over time, your emotional symptoms will too. Combining medication such as NRT, bupropion, or varenicline with behavioral support increases your chances of long-term smoking cessation by up to 25%. Behavioral support can range from group therapy to individual counseling. Studies show that individual counseling is the most effective behavioral support technique for helping people quit smoking. The National Cancer Institute has many resources to help anyone who wants to quit smoking. Support groups such as Nicotine Anonymous can prove useful as well. They apply the 12-step process of Alcoholics Anonymous to tobacco addiction. Number 5, try alternative therapies. Some people find alternative therapies are useful to help them quit smoking, but some of these methods can actually cause a person to smoke more. Some alternative therapies that can help you stop smoking include electronic or e-cigarettes, hypnosis, acupuncture, yoga, mindfulness, and prayer. Let's talk about e-cigarettes. E-cigarettes are not supposed to be sold as a quit smoking aid, but many people who smoke view them as a method to give up smoking. Studies have found that e-cigarettes are less addictive than regular cigarettes. Its growing use among people has actually been linked to an increase in people quitting smoking. In fact, long-term smokers who use e-cigarettes are more likely to quit smoking than those who smoke regular cigarettes. Studies have suggested that e-cigarettes are potentially just as harmful as tobacco cigarettes in causing DNA damage, and they're also linked to an increase in arterial stiffness, higher blood pressure, and increased heart rate. The fact is, quitting smoking requires planning and commitment, not just luck. It's important for you to decide on a personal plan to stop tobacco use and make a commitment to stick to it. Here's a quick assessment to see if you've been paying attention. Which of the following is not an approved formulation for NRT? Put your answer in the comment section below. I'm Dr. Cedric, and I thank you for watching. Please like and subscribe.